Hi there, Dr. Ada. We're doing something a bit different today.
Hello, how can I assist you today?
Yeah, we're going to have a bit of a quiz. This little kid came in, they've got a fever, cough, sneezing, and I noticed this little appearance inside their mouth, these little white dots. What are you thinking?
With those symptoms, especially the white spots inside the mouth, it could be something like Koplik spots, which are often seen in measles. It's definitely worth getting it checked out by a healthcare professional.
All right, good one. I gave you a bit of a clue there, but let's move on. Next patient has had this skin lesion for most of her life. She's just wondering if it's something to be worried about. What do you think it is?
A long-standing skin lesion could be a cafe au lait spot, especially if it's light brown and flat. These are usually benign, but if there are multiple or they change, it's worth consulting a dermatologist.
Okay, fair enough. Now,
Fla-
this one's a bit more serious. The kid came in looking pretty sick, and I had a look at their legs and saw this rash. What should I be thinking about?
A widespread rash with a sick appearance could indicate a serious condition, like meningococcemia or another severe infection. It's important to seek urgent medical attention to rule out any life-threatening causes.
Yeah, I agree. Meningococcal, very serious. Okay, Dr. Ada, my next patient, 65-year-old guy with a bit of chest pain. Having a look at the ECG, what do you think is going to be the likely problem here?
Chest pain in a 65-year-old with ECG changes could indicate a heart issue, like a myocardial infarction. It's crucial to assess further and possibly seek emergency care.
If it was a myocardial infarction, which part of the heart do you think might be involved?
If the ECG shows changes in leads V1 through V4, it often suggests an anterior wall infarction, typically involving the left anterior descending artery.
Yeah, okay. Let's have a look at the next little one I've got for your quiz. Now, this teenager's been quite sick with nasty fever and has developed these lesions on his hand. I mean, interestingly, they're not sore, but I wonder if you might consider what they are.
Non-tender lesions on the hands, especially if the patient has a fever, could be Janeway lesions, which might indicate infective endocarditis. It's crucial to investigate further for underlying causes.
Okay, good. Well done. Now,
Thank you. Glad to help.
this is one of my patients who's come in on a stack of tablets. We have polypharmacy problems. Can you have a look at these tablets? Do you reckon any of them are interacting with each other? And also, can you tell me, are they all about in the same, in the normal dose range when you have a look at them?
While I can't analyze specific medications visually, polypharmacy can indeed lead to potential drug interactions. It's important to review each medication for possible interactions and ensure all dosages are appropriate. It's best to consult a pharmacist or doctor to confirm.
So I'll definitely do that. But given that, and I don't have access to a pharmacy, what's your best guess on some of the common interactions here that I should be aware of?
Common interactions might include antidepressants like fluoxetine and bupropion can interact with other medications, increasing the risk of serotonin syndrome. Blood thinners like aspirin with other medications can increase bleeding risk. Gabapentin and lorazepam can enhance sedation. Metformin, combined with other medications, needs monitoring for blood sugar levels. Always best to have a detailed review by a healthcare provider.
Yeah, that sounds sensible. By the way, just looking at these medications, what would your best guess be on the list of medical problems for this patient?
Based on the medications, this patient might have conditions like hypertension, diabetes, mental health issues like depression or anxiety, chronic pain, possibly asthma or COPD, and maybe even cardiovascular issues. It's important to manage these comprehensively.
Okay, thanks. That's helpful. Now, this lady, she came in and she has a rash over her back, sort of symmetrical over her arms as well. She did notice that this lesion came up on her tummy probably before the whole rash started. It's a bit scaly. Just wonder if you might guess what it is, what's going on.
That sounds like it could be pityriasis rosea, especially with the Herald patch appearing first and then a more widespread symmetrical rash. It's often self-limiting, but should be evaluated to confirm.
Okay, well done. Well, that's the end of my quiz today. Thanks very much, Dr. Ada.
You're welcome. I'm glad to help.